You're watching Reality Check. Controversy has erupted over the claims of alternative cures as being able to cure, quote unquote, the coronavirus. From Patanjali and Baba Ramdev to even all the way south in Tamil Nadu. But let's first start with Patanjali. So Patanjali had a splashy launch of its supposed coronavirus cure called Coronil, with Baba Ramdev and his associates launching it, claiming that it had a 100% success rate, only to have a rap on the knuckles from the Ayush Ministry saying that they should withdraw their ads and their promotions until they provide more information about exactly how they have made these claims. Now Patanjali in response released a letter today, which essentially they had received from the Ayush Ministry today, saying that the ministry has received its various details submitted by Patanjali, the various documents pertaining to the clinical trials of Coronil. But the ministry says that the documents that they have received will have to be studied and verified, indicating that Patanjali may have actually jumped the gun and launched without a verification, submitting the documents only after the ministry raised a red flag. Now, my colleague Mariam Alavi joins me because further evidence may have emerged that Patanjali in fact may have jumped the gun, and this, Mariam, pertains to the government registry where clinical trials are supposed to be registered. Now, what is that telling us about the status of this Patanjali's supposed miracle cure?
So all clinical trials, they're registered on the CTRI, the Clinical Trials Registry of India, and our colleague Aravind Gunasekaran noticed that in the Patanjali press release, they had in fact mentioned their CTRI registration number. Using this, he tracked down the study and the trial and what the current status of it is on the website. According to the website, this number matches exactly what is given in the press release. It says that the study is sponsored by Patanjali. It is the primary sponsor is Patanjali, and in fact, in that study document, it says date of study completion. It says applicable only for completed or terminated trials, which suggests that probably the trial of this drug is still not completed. The Patanjali drugs, the clinical trial is still not done.
I see. So the clinical trial registry of India, which has this Patanjali's clinical trial status on its website, suggests that the trial has still not been completed. The trial may still be underway, and yet Patanjali has gone ahead with its launch. But also, another interesting question mark arises, Mariam, and this is something which is an Ayush Ministry's own notification dated the 1st of April. This is literally at the beginning of the wave of coronavirus hitting India, where it actually put a ban on anybody promoting coronavirus cures.
Yes, on the 1st of April, the Ministry of Ayush had in fact issued an order which clearly says that it is hereby directed to all concerned ASU and its regulatory authorities, that is the Ayurveda, Siddha, Unani and Homeopathy regulatory authorities in the states and union territories, to stop and prevent publicity and advertisement of Ayush-related claims of COVID-19 treatment in print, TV and electronic media, and take necessary action against the persons or agencies involved in contravening the relevant legal provisions and the aforesaid guidelines of the NDMA. So this was issued on the 1st of April. So which means that Patanjali's advertisement and their promotional activities very much happened while this order was still out. So the question arises that even despite a ban on advertisements and promotions of Ayush related COVID cures, how was Patanjali able to promote, advertise their supposed cures?
Take out these advertisements. Right. That's a big question, given that there's a supposed ban on advertising any such cures and action against those who do it. Okay, thank you very much indeed, Mariam. The other twist in the tale came when the Uttarakhand government, where these particular medical items, drugs, whatever you call them, by Patanjali have been registered, turned around and said that Patanjali may have misled them, saying that they registered only as an immunity booster, not as a cure for COVID. Let's listen.
ये 10 जून को पतंजलि ने ये 2-3 प्रोडक्ट के लिए एप्लीकेशन हमारे कार्यालय में दी और इसके बाद हमने इसको पैनल में रखा। पैनल ने इसका परीक्षण किया। पैनल परीक्षण होने के बाद 12 जून को हमने इनको लाइसेंस जारी किया। उसमें इनके द्वारा कोरोना के ट्रीटमेंट से संबंधित कोई भी क्लेम या कोई भी नाम उसमें नहीं लिखा गया है। हमारे द्वारा जो उसको अनुमोदित किया गया है उसमें इम्यूनिटी बूस्टर और कास और श्वास, खांसी और बुखार, इसके लिए उसको अप्रूव किया गया है।
Now, Patanjali is still a private company, but we travel to Tamil Nadu, where the state government itself is promoting an alternative treatment known as Siddha for not just treating or acting as an immunity booster for people trying to protect themselves against COVID, but actually as a cure for coronavirus. Sam Daniel reports.
This young woman in Chennai had tested COVID positive with mild symptoms. She chose to admit herself here at a private engineering college now converted into a treatment center for Siddha, Tamil Nadu's old form of herbal medicine. A week later, she has no symptoms, now returning home.
Got symptoms in cold, cough, no smelling sense, no taste sense, nothing. Now I'm all right.
And why did you choose Siddha?
My relation told, that's why.
Siddha uses herbal concoctions, largely undocumented, with no scientific scrutiny on trials and results. Yet the government is aggressively promoting it, claiming there's 100% recovery. 200 COVID positive patients are being treated here. They claim the Siddha option is offered only for willing, asymptomatic and mild cases. There's a major contradiction on the ground. Siddha doctors say both moderate and severe cases are admitted against the government's claim that only asymptomatic and mild cases are referred for Siddha. This elderly lady with diabetes and heart ailments is returning home recovered after 8 days. With no oxygen and ventilator support at these centers, it's a gamble.
Mild symptoms getting good result in 6 days or 7 days. But severe symptoms getting relief in 8 or 9 days.
Suddenly, if they require ventilators or oxygen supply, what do you do here? Severe cases.
Sir, I am daily watching the patients with the pulse oximeter. We know which patients oxygen level is going below 90, below 85.
Move them to allopathy hospitals?
No.
Initially, the Tamil Nadu government promoted a Siddha concoction only as an immunity booster. But now it's being promoted as a cure to appease its ally at the center, the BJP.
So we have to blend yoga, Siddha and Ayurveda.
We are also treading into unscientific territories.
We believe Siddha is as scientific as allopathy. They may not have the empirical verification process of an allopathy, but they have enough of history.
Is Siddha a wonder medicine without scientific backing? Or is it being pushed for a political agenda, putting lives in danger amid allegations of shortage of beds against exponential rise of numbers? In Chennai, with camera person Edwin, Sam Daniel, for NDTV.
All right, joining us tonight on Reality Check, we have with us K. Pandirajan, Minister in the Tamil Nadu government, who we just saw there. We also have Dinesh Upadhyay, who's member of the Ayush Ministry of Government of India. We have K. Sujata Rao, who's been former Health Secretary, Dr. T.S. Sundaraman, who is the head of Jan Swasthya Abhiyan, and also Dr. Shivaraman Arogya, who is a Siddha physician and member of the task force of the Tamil Nadu's COVID management team. Thank you all so much for joining us. Now, just to start off with you, दिनेश उपाध्याय जी, कि ये आपसे पूछना था कि किस तरह से ये आपने पतंजलि का अगर देखा जाए कि पतंजलि आपके खुद के ऑर्डर्स हैं अप्रैल 1 के कि किसी तरह से कोई भी एड प्रमोटिंग कोविड क्योर नहीं निकाल सकता, और अगर कोई निकालता है तो उनके खिलाफ इमीडिएट एनडीएमए एक्ट के तहत कड़ी से कड़ी कार्रवाई होनी चाहिए। तो कैसे इस किस्म के एड्स निकल रहे हैं, कैसे ये क्लेम्स हो रहे हैं, ट्रायल्स के रिजल्ट रेडी नहीं हैं?
राष्ट्र के अंदर सरकार की गतिविधियों का कानून के पालन का अगर कोई भी राष्ट्र के अंदर सरकार की बनाई हुई गतिविधियां या कानून का कोई उल्लंघन करता है वो गलत है। और मैं फिर स्पष्ट करना चाहता हूं, कोरोना की किसी भी दवाई
तो
को
क्या पतंजलि ने गलत किया है? मैं आपको देखो ये लाइन में दोहराई, मैं फिर दोहराता हूं। नहीं तो क्या पतंजलि ने कानून का उल्लंघन किया है? आप ही के अप्रैल 1 के ऑर्डर के तहत, आप ही के ऑर्डर के बारे में मैं पूछ रहा हूं, क्या उसके तहत दे आर इन वायलेशन ऑफ द लॉ? एंड इफ दे आर, तो व्हाई हैव यू नॉट आस्क्ड फॉर एक्शन अगेंस्ट देम? उनके खिलाफ एक्शन के लिए क्यों नहीं पूछा आपने?
कोरोना की दवाई कह करके बेचना ये गलत किया, अच्छा नहीं किया, ये गलत है। लेकिन इसके साथ में एक बात मैं और भी जोड़ता हूं, राष्ट्र के अंदर इनके अलावा और भी कई लोग इस तरह की दवाइयां हमारे संज्ञान में, मेरे संज्ञान में भी आई हैं कि ये दवाई कोरोना को समाप्त कर देगी। हमने किसी को भी इस बात का आश्वासन कभी दिया नहीं कि कोरोना, इसको लेने के बाद कोरोना होगा नहीं या कोरोना को ये समाप्त कर देगा। ऐसा दवाई के लिए अपनी सरकार ने किसी को अब तक
आश्वासन
नहीं किया।
आश्वासन
और अगर पतंजलि ने
नहीं, आश्वासन की बात अलग है और एक्शन अलग है। अच्छा, दूसरी बात, let's I'm asking on action, but K. Pandirajan, I want to ask you that, leaving aside the fact that, you know, as the Ayush Ministry itself says, you can't even legally promote cures, alternative cures for corona. Now, it's one thing for a private enterprise to do it, but here the Tamil Nadu government is doing it with Siddha. Isn't that risky? And
not really.
Sorry to say, a bit
I
irresponsible.
told you already, Siddha medicine is not one of those undocumented quack therapies. Okay, Siddha has a history of over 2,000 years in Tamil Nadu. There's a lot of documented history around it. The deep faith in Siddha that many Tamils have here.
But
and
documented.
I think, yeah, well documented,
No, but
and
documented
it's been
history
through.
Well documented for what though? Because here, Mr. Pandirajan, you are not just suggesting it as an immunity booster. You're actually using it to treat COVID patients. And as Sam points out, controversially, there are not just mild or asymptomatic patients being treated, there are even those who have serious symptoms.
Now listen, the model that Tamil Nadu government has adopted is to blend Siddha and allopathy. So for instance, when the oxygen support is needed, your person asked the question to Dr. Veerababu. I don't think the answer got recorded. Government has put in each of these, this is not the first Siddha COVID care center. Tamil Nadu has many COVID care centers. This is a concept which we brought into Chennai. For each zone, there are 4 or 5 COVID care centers.
Sure.
We have a 4-level treatment. One is really asymptomatic, where we have kept the person in home quarantine. The second level is the COVID care centers. Third level is COVID.
We understand that.
No, hang on. See, I don't think the understanding.
No, but I think the point is not. No, hold on.
No, the point is COVID care centers which
I'm
really
saying,
treat
I'm not here on the protocols.
Yeah.
I'm talking about the evidence, and this is where Sujata Rao. If I may just bring in Sujata Rao, is this?
No, let me just complete.
That you have
Vasu, I think the track of the discussion. No, please, that's not unverified. Please, I want you to correct something which is getting recorded here. Tamil Nadu government has not put this as a treatment for the cases which are advanced. Moderate cases where we started with one center first.
Okay.
This is actually the fourth place where when the person gets to need oxygen support, the person actually gets transported from here to a COVID hospital, which is the fourth level. COVID hospital, COVID health center, COVID care center. Yeah.
Accepted. Okay, accepted. You are still, but you are still treating COVID positive patients with Siddha, which Sujata Rao, I mean, is there any basis for this? Whether it's what Tamil Nadu is doing or the claims made by Patanjali, is this a matter of concern?
No, please don't link Patanjali with the work that we are doing here. We are not using Patanjali products. We are using trained and tested products in Siddha.
No, I'm not saying you're using Patanjali products. I'm not saying you're using Patanjali products. I'm not saying you're using it. Sujata Rao, please come in.
Also, that's right. I also agree with him that you have to separate Patanjali and what they're using in Tamil Nadu, which is a Siddha. And Siddha is very popular in Tamil Nadu, and it is being used for various ailments. That said, I have to say that I don't agree with the current situation in Tamil Nadu, largely because we ourselves, even in allopathy with all their science, rigorous science, have so many knowledge gaps and so far as COVID is concerned. And even in allopathy medicine, with all the clinical trials that they're trying to do, they're not able to come up with an effective medicine, even though we know it's sequencing, we know it's the cousin who is SARS, and SARS has been treated and so on. So when there's so many gaps, for Siddha is certainly has its own scientific basis, I'm not denying that, but it has, what is the research work done on viral infections and an infection like COVID? COVID being so infectious, and look at Tamil Nadu, how it's raging. I don't understand how Tamil Nadu government is risking patients to be treated by an unproven treatment protocol. So now, as he clarified, it's not for treatment, but at the same time, they're saying that up to severe cases you can treat. So there's a contradiction. Secondly, I also take objection to why asymptomatics and mild cases are being sent to any hospital, whether it's a Siddha hospital or an allopathy. They ought to be treated at home with proper treatment protocols that are already laid for mild cases. So, Siddha has maybe have its own strengths, but I certainly don't agree that without proper scientific evidence, even for Siddha basis, without that to be extending it for treatment. I've seen this happen in HIV with very unfortunate outcomes.
Okay, Doctor.
I don't think it should be done.
Right, Dr. Siddha. Dr. Siddha.
I think it's completely.
Dr. Siddha. I'll come back to you. Yes, Dr. Sundaraman.
Let me try to explain one very basic fact about treatments and disease like COVID-19. If you take asymptomatic, mild or moderate 100 patients with COVID-19 and give them anything under the sun, 96 will improve. They improved because of their own the nature of the disease. We know what only 4% go into critical care, and we know what 1% to 2% mortality. But therefore, the majority of people will improve on their own, and therefore any remedy is tried, will tend, and they have chosen only mild and moderate patients. And as a result of the whole process of selection and things, you can come away with anything. The danger of this is you are seriously distracting and giving a wrong message to the entire population about what is the nature of health seeking they need to do to protect themselves. And that distraction in Tamil Nadu or in Delhi is really serious. It is at some point something that we cannot afford at all. And I think this is a new disease. You cannot say I have a 1,000-year tradition. This is for everybody a new disease. I think I'm really, really concerned that also some of these things are closely linked to profiteering. Maybe I don't know about the situation. Patanjali definitely. Huge profits where you market hope, you play on the anxieties of people and you actually establish a thing. These are all things that people should be protected by the
let me just bring in, let me bring in Dr. Shivaraman. Let me bring in Dr. Shivaraman Arogya, Siddha physician, part of the Tamil Nadu government task force. Dr. Shivaraman, the point is that the Ayush Ministry itself, as we said at the outset of the program, has said that you cannot actually promote any alternative cures that come under the Ayush umbrella, which includes alternative cures like Siddha, as treatment for COVID. You can say immunity booster, but not treatment. But you are going ahead and using it to treat COVID. Aren't you, in a sense, falling afoul of the government's own guidelines here?
No, sir. That's a clear guideline from the central government. Says for a immune enhancement, we can use the Kabasura Kudanir and Nilavembu Kudanir to Indian Siddha medicine regime. They asked to do that. And based on that, on April 23rd, Tamil Nadu government issued a clear protocol for, in the protocol you can see one part is for immune enhancement and the second part to for a research purpose, and in this asymptomatic and mild cases you can make it as a with allopathy and complementary care you can do. At the same time, you have to get the IEC approval and CTRI approval and do that. So based on that only the study started. So first thing I would like to tell, don't tell that this is totally unscientific. So we have our own science basis, as well as we are also understanding the disease according to the modern science, and we selected the Indian Siddha system or Indian Siddha medicine, the decoction, based on two ways. One way, how in the Siddha perspective this can be helped for COVID, and another way, according to the COVID science and
the point
symptoms,
is,
how it can be. Yeah, please tell me.
Yeah. But sir, I'm saying the point is that this all has to be, there has to be clinical, let me just say, there has to be clinical trials. There has to be trials, there has to be results which are reviewed and approved by the government's own, if I may finish, by the government's own, by the Ayush Ministry's own admission, nothing so far, no alternative cure has got that clinical, either has completed a trial, has got the go-ahead. Nobody has done it, and that's the concern, that despite that, you are going ahead. But I don't want to just get stuck in Siddha. I don't want to just get stuck on Siddha, because I want to come back to Dinesh Upadhyay.
I think
there is a trial is going on with a randomized clinical trial with Siddha medicine at Stanley Medical College and Central Clinical Research Institute. They are recruiting the patient, they are studying the viral load and how best it is improving the IL-6R and IL-10.
But
studying
while the trial is going on, fair enough, but I'm saying, sir, while the trial is going on, hold on, you've not waited for the results. You've already started treating people with it. I think that's the issue. But last word from you, Dinesh ji.
I would like to understand. I would like to say that it is not,
Dinesh ji,
not getting deep.
Vasu, I must record this. Please allow me a minute, because the statement which got made. Vasu, allow me a minute. I just need to record this.
We are very short on time.
Yeah, no, it's fine, but I still need to record this one thing.
Mr. Pandirajan, very briefly. Mr. Pandirajan, very briefly.
Listen, the crux of your discussion seems to be revolving around, the COVID care centers, what we have. If it is allopathy or anything else, it will be 96%. If it is Siddha, it will be the same 96%. It's not so. We have been able to establish that during these mild cases, in these mild cases, the recovery has been close to 100%. That's what the first center demonstrated. Okay, so it's not that any case guys will recover, it will be only the same 96% kind of a thing. It's not so, and that's Tamil Nadu's experience. And that's also Kerala's experience with Ayurveda.
That's a that again.
Yeah,
we will be very careful when we make these claims, as I said, with cures and remedies that are still under trial.
I think it's completely born out of.
Okay, we're out of time, gentlemen.
If you really look at it.
Okay, I wanted to go back. I wanted to go back to Dinesh Upadhyay. We're out of time. Gentlemen.
I don't think they have followed any scientific protocol.
Let's take a deep breath.
There's some few cases which without.
Okay, we're out of time, gentlemen. We will come back to this.
Allopathy is empirical science.
Okay, Dr. Sundaraman, Pandirajan, please allow me. We're out of time. Okay, thank you so much for joining us. That's all the time we have on Reality Check. Thanks for watching. Good night.